Hello, good evening. This is Dr. Karen Sullivan. I am back with you again for another Wednesday night I Care for Your Brain. We have been doing this for 2 years now, trying to come to you once a week with high quality evidence-based information. And why do I do this? This is because information really matters, and you need a reliable, trustworthy source to get high quality evidence-based information about the brain. Many of you out there have a brain health challenge, but you have not been nicely, kindly, comprehensively educated about it. And it's very important to me that I share the information that I have with you, people who it will really make a difference to. So what we're going to talk about tonight is hydration. This is a very important topic, often overlooked as a modifiable risk factor for cognitive, physical, and emotional symptoms. What is a modifiable risk factor? It is something that potentially makes an area of functioning worse, and we can do something about it. But like so many modifiable risk factors, if you don't know what to do better, then you'll never do better out of sheer ignorance. So that is a big value here at I Care for Your Brain, is you need to know how to do better so you can have a higher quality of life. So despite water making up 60 to 80% of the human body, we often don't respect it as a significant nutrient. We spend a lot of time talking about vitamins and supplements and different molecules we need to get in our body, but we really need to take the basics seriously. Dehydration is one of the top 10 frequent reasons that people go to the hospital, especially as they get older in the United States. Everyone is at risk for dehydration, but the two populations that most of the literature has been on is children and older adults. So as an adult-focused neuropsychologist, we're going to focus on the older end of the aging spectrum. But this topic is actually very relevant to any of you who follow me here who have a brain health or a mental health challenge, because it basically makes everything that you struggle with worse, whether it is a processing speed issue, whether it is a memory problem, whether it is mood swings, whether or not it is fatigue, whether or not it is headache. Every single thing that can go wrong in the brain is made worse when we are not properly hydrated. This happens when we are ignorant. We just don't know how much water we actually need. We can have a lack of awareness about the delicate balance between our output and our input, maybe not realizing, hey, we're in a warmer temperature, or we just did a lot of physical activity, we need to increase our liquid. But we can also have biological failure of the thirst sensation, and we don't get that normal signal that basically tells between the brain and the body, hey, I'm thirsty, this is the sensation of thirst, and how to follow through on that sensation. When we are poorly hydrated, it impacts everything, the way our body feels, the way our emotions are, the way our cognition is, the way our brain thinks. Water serves so many vital purposes. It is a critical nutrient in the life of a cell. I'm going to tell you a little bit later how much of your cells are made up of water. Basically, think of it as kind of the most essential building block throughout all the cells in your body. It does many things. Water regulates our body temperature, and it does that through that combination of sweating and respiration, right? Our skin, the largest organ, knows how to take moisture and get it in and out of the body as necessary. The carbohydrates and the proteins and the sugars that we get through our diet that our body needs in order to survive are basically metabolized and transported through water in the body. It helps us to flush waste throughout the bloodstream. It helps deliver oxygen to every cell and organ in our body. It acts as a shock absorber in the brain and the spinal cord, a very important role. It helps to form the saliva that is in our mouth that helps us to fight airborne viruses and infections, and helps us to dissolve our food to be able to digest it. Water lubricates our joints. It basically does everything that we need to live in a human body. But unfortunately, as we get up in years, especially once we get past the age of 65, we have almost a 50% chance of not being properly hydrated. And those numbers actually get way worse if you live in any type of a care facility or if you have dementia of any kind. Studies looking at people who live in long-term care facilities show that if you just went in randomly unannounced and basically tested residents, almost 50% of them who had a fever would be diagnosed as being clinically dehydrated. And 20% of these people from nursing homes, care facilities, who are brought to hospitals for emergency medicine are admitted due to dehydration. Some studies have even shown that up to 98% of care residents in facilities do not consume the recommended fluid intake. 98%. So we're not even talking about dehydration really in this conversation. I'm even talking about suboptimal hydration. So this isn't like, you know, you're dry as a bone. This is just if your cells aren't receiving the most optimal needed level of hydration. Even very mild, the suboptimal hydration I'm talking about can affect our energy level. It can give us headaches. Have you ever heard that kind of urban myth that when you take 2 ibuprofen with a glass of water, it's not even the ibuprofen that really helps you, it's probably the big glass of water. We also know that inattention, dizziness, there's so many things that can be behind the scenes driving it, and this dehydration is one. So why does this happen in facilities more so than any other place? Well, unfortunately, the people with the most direct hands-on, one-on-one care with patients are unfortunately the most inadequately trained and oftentimes the least paid people in the totem pole. And I hate that. If there was something I could do with my magic wand, I would help direct care providers be more respected, receive better training, and be paid more, because they are the true heroes in institutionalized care. It's not necessarily the doctor who comes in once a week and writes the prescriptions. We really need to be giving our respect and our dollars to the people that actually do the care. Am I right? So unfortunately, these people are just not that well educated about the importance of hydration. The other thing is liquids are often inaccessible to residents who sometimes can't drink without assistance, leading to very low intake of fluid. Then we add on top of it physical disability, visual impairment, maybe a speaking problem where they can't actually voice the thirst, or there's incontinence too. For some people, they can't hold on to water. So there's all sorts of reasons that that can happen. And as we get older, exactly, Lisa, amen. As we get older, dehydration is really a significant problem, because we know that as someone is not properly hydrated, they stay longer in the hospital, they die earlier, they have more falls, hence more fractures, they can be more confused, they can get more constipated, which just that in and of itself can make people with any type of baseline cognitive impairment much more confused. Pressure ulcers, blood clots, wounds don't heal as well when we are not as hydrated. And overall, we just get suboptimal outcomes. People are much more likely to get an infection. You can have a seizure if you're not properly hydrated. Drugs can stay in your body more. And overall, it just is not good for quality of life. So two of the big reasons that this comes up with age is because we do have less body mass and less total body water that we can carry in our muscles and in our cells as we get older, especially if you're diabetic, have any type of issue with your kidneys, or just are moderately overweight. We also have a harder time holding on to salt and fluid as we get older, which is one way that our cells are smart to hold on to the liquid. Many medications that we take can actually reduce the amount of water in our cells. And like I said, anything going on with the kidneys. So if you have any type of diabetes, chronic kidney disease, anything like that, you have to be very mindful of hydration. So let's imagine now you're older and you have more than normal changes in your memory or in your executive functioning or your word finding, and you meet criteria for dementia. Now dehydration kind of takes on even more of significance for two reasons. It's going to even be harder for you to recognize when you're thirsty and what to do about it. And it really is going to make your confusion and your altered mental status even worse. So one of the things people don't often know about Alzheimer's disease, as one example, is that in addition to the memory problems and some of the so-called behavior issues, is basic visual deficits that happen in Alzheimer's. And this was my life for many years when I was a grad student at Boston University. We studied in my laboratory the impact of visual deficits on everyday functioning in Alzheimer's and what to do about it. So think about if you want to open up the refrigerator and just find a drink, right? And you have object recognition problems, you have visual search problems, you maybe have an issue with detecting objects as they stand out from other objects in a complex array. These are the things that people who live with Alzheimer's typically experience. And so sometimes they might actually go to the refrigerator to get a drink, but they literally can't find the drink. Or they might go to the faucet to get some water out, and they have a hard time distinguishing the silver of the faucet where the water comes out against the silver of the sink that is the backdrop visually for them to figure out where to put their hand to actually turn the water on. Even when there's an awareness of the thirst, right, and people actually go into the kitchen, sometimes there's sequencing issues that can get in the way when you have dementia. You have to get the cup, get to the sink, turn it on the right way, make sure it's not too hot, not too cold. So these things can really get in the way. We also know that we get very short-tempered when we are not properly hydrated, and so we get more frustrated, we get more anxious, and this might lead to some of those so-called behavior problems that we see. Dehydration is just bad news across the board for cells. So before I said I would tell you how much water is in a typical cell, and I wonder if you guys can guess. What would you say? Is it 20%? Is it 50%? Or is it 70%? It is number C, 70%. Cells have approximately 70% water mass, but it even gets higher when we get into the brain. We think that the brain is almost 75% water, and the rest of it is mostly fat. That's a whole other conversation we could have one day, is the importance of good, healthy fat. In brain cells, neurons, water is absorbed and released when there is messages that are being communicated back and forth through electrical and chemical messengers. Low water means low transmission. So even just some of that very basic mild dehydration can cause difficulty in cells communicating. In research subjects that were chronically dehydrated, we also see actual brain volume reduction, so a shrinking of the brain. We actually know that circulation in the brain starts to go down as we have a loss of water. We also know that as we're caring for people with dementia, we know that sometimes they have swallowing and actual mouth issues that prevent them from drinking. Sometimes people just actually refuse to drink. So we have to make sure we're being creative and person-centered about how is it that we can go about getting more liquid into people. And as you know, if you've been following me, we try to do an interesting lecture at the beginning with some good, solid information. But what I really care about is where do we go from there, right? How is it that I can give you good recommendations for how to make a change? So when we think about dehydration, the worst thing is these folks who are chronically dehydrated. Okay, so when you are chronically dehydrated, basically, like I said, everything gets worse, right? So how do we know exactly how bad dehydration is for the brain? The whole reason we know this, besides animal literature, is actually thanks to our military populations. This is just another reason to be grateful to people who serve. Soldiers have been used in many, many different research experiments because of their exposure to heat, because of their exposure to doing very intense physical things and being dehydrated. We actually know a lot about the cognitive deficits that come along with dehydration because of military folks. Basically, it shuts down almost every function in the brain. When you ask people who are dehydrated, they talk about feeling less alert. I had difficulty concentrating. I felt overwhelmingly exhausted. I felt a lot of tension and muscle tightness in my body. So the people I worry about are the people that don't have the voice to tell us this is how I feel, right? And that's why it's up to us who are lucky enough to have voices and to be living in brains at the moment that are high functioning, to advocate for the people who aren't as lucky right now in their life. So even if you lose 3% of the water in your whole body, you will meet criteria for dehydration. Isn't that interesting? Interestingly, there is no gold standard for how to mark dehydration. There are some clinical screening methods where they look at certain types of molecules that are in urine samples or even blood samples, but the good old standard way to know about dehydration is to look at the color of the pee. Okay, the lighter the better, the darker the worse. Okay, if you go into an emergency room and they're worried you're dehydrated, they basically try to get you to leave a urine sample, and they're just looking at the color of that output. You can also think about when people have quick blood pressure changes, or when all of a sudden they're acting agitated or they're much more lethargic than usual. These are some of the parameters that we use, but basically it comes down to something as simple as looking at the color of someone's pee. If you know someone with cognitive impairment and they seem more drowsy than usual, their skin is always dry, their hair is kind of brittle, their blood pressure tends to be low, if their heartbeat gets rapid, any type of acute illness, you always want to go for dehydration first, okay? That should be your very first pass. So a 2016 literature review on this problem came up with some really great common sense recommendations that I wanted to pass along with you, which is basically we need a village. A multi-component, person-centered strategy is what we need to do. So this is so important that everyone who is surrounding an older adult, whether it's family or whether it's a caregiver, understands the importance of optimal fluid intake. So in the United Kingdom, they actually have a regulation called Regulation 14 of the Health and Social Care Act as of 2008 that addresses that facilities and care providers have a responsibility, I love that term, to ensure that people who use their services have adequate nutrition and hydration to sustain a good and healthy life. Now, I wish that we had something like that in the US. Care providers should therefore have a strategy to ensure that every resident has access to water, beverages, and the necessary support to be well hydrated, okay? This is critical. So what you have to start off with is an individual assessment. This is a theme you hear from me again and again. Every one of us is different. Everyone's brain is different. Everyone needs something slightly different. We have to personalize care. So you can basically categorize people who are at risk for dehydration into 3 categories. They can either be someone who can drink, someone who cannot drink, or somebody who will not drink. And once you identify what category they're in, you basically go from there and try to figure out what are the things that we can do that will make this person take in more liquid. Now, I want to change your mind from just thinking this is about water, because it's actually not. I'd rather you think about it like this. The goal is to optimize wet food. This can be ice. This can be soup. This can be fruit. This can be vegetables. Some of the most hydrating foods are things like cucumbers, okay? Cucumbers have 95% water. Melons, watermelon has 92% water. Strawberries, 91% water. Peaches, 89% water. Oranges, 88% water. Things like broths and soups, we know more and more that these things are very, very sustaining for the body. Coconut water would be an excellent alternative to something like those crappy sports drinks, right? They're full of artificial colors, so much sugar, terrible for the brain in almost all cases. Coconut water has electrolytes, it is very hydrating, has vitamins, okay? In people with dementia, there's actually been studies where they look at just putting flavoring in the water, changing the color of the cup. Many of you have heard, if you follow research on Alzheimer's disease, a little something called mashed potatoes on a white plate. This was a study that was done at Boston University by a researcher named Tracy Dunn and her mentor, my mentor, Alice Cronin-Galome. And what they did, this was the generation right before me in grad school, it was because of this study that I was hell-bent on getting into this program because I was so impressed with the practicality of the study. They basically showed that some of the visual deficits in Alzheimer's are contrast sensitivity deficits. So this is if you put milk into a white cup, the person with advanced dementia isn't going to drink it because they literally can't see it. So Dr. Dunn and Dr. Cronin-Galom went into an advanced care unit in a VA and simply replaced the cups with red cups and the plates with red plates. And they were able to dramatically increase the amount of food these people were eating and the amount of liquids that they were taking in just by changing the color. And now this news story circulates every few months. I recently actually saw it and sent it over to Dr. Cronin-Galom. And there's companies who literally make red plates and red cups to cash in on this research finding, but you probably have colored cups already in your house, so you don't need to worry about that. But isn't that fascinating that some of the resistance might be that they literally can't visually perceive it anyway? We always want to use a positive approach when we are trying to support someone with dementia, right? And so sometimes what that means is instead of offering a choice like, would you like a drink? We can just say, here's something really delicious that I had, and basically start the actions that will result in them actually drinking. So you kind of take some of the option away, okay? Having fluids available and accessible at all times, offering them regularly throughout the day, fluid rounds, hydration stations, these things are very important. As we get older, the research tells me that we become fans of drinking what they call little and often, and not necessarily drinking 10 to 14 ounces at a time. We always want to make sure we offer people a variety of drinks. Some people aren't water people, right? Any non-water people out there now? Some people like cold drinks. Some people like hot drinks. The key though is you want the liquid to be fresh and you want it to look good. It needs to be visually appealing. We also know that we can get imaginative with drinks, right? There's plenty of care facilities that do, coffee bars or mocktails, or when I was an activities director in my previous life, we did social teas, and that was one of my goals, was to always make sure that there was a lot of different interesting things that people could drink, because here we were all being social, and a lot of times we go on automatic behavior and people would tend to take in a lot of liquid. It was really good. We also want to potentially bring in familiar drinking cups. If you know someone who's in an institution, bring in a cup from home. They're not necessarily going to want to drink in the nursing home or the hospital cup. That should really be fine. We also want to make sure that the cup is actually accessible to the person. I know that the world is on an anti-straw campaign right now for good reasons, but the truth is, for people with different types of disability, they need the straw to be able to freely drink. And so we need to make sure we're meeting people where they are in terms of their physical barriers to drinking. One of the things that we're going to post in the comments when I'm done, or maybe it's even been done already, is we have a free handout for you that reinforces some of my most important points, and that you can actually use to track your own drinking to make sure you are more optimally hydrated. If you thought that this information was helpful, I would be so grateful if you would just share it. Share it on any groups that you know that care about the brain. The reason I do this and am committed to doing this in the future is simply that information heals, information helps, and we have no barriers on Facebook as it is right now for sharing this information freely. People don't have to pay for it. It's simply a matter of pushing a play button and having access to this information. But I really try hard to pick the information I share with you carefully, because I think that it really, really makes a genuine difference. I'm going to be back with you again next Wednesday. Thank you, Jerry. You're so supportive. I will be back with you next week, and what I'm actually going to talk about next week is some amazing partnerships that we have been working on that are finally coming to fruition. We have been working hard behind the scene to try to join forces with other people who have the same heart and motivation for this brain health care revolution that we're trying to be a part of, and I'm excited to tell you about it next week. There's 3 different groups that we're working with right now, and I will share that info with you next week. And specifically what I care about is how can it benefit you or your loved one in your brain health challenge. So thank you guys again so much. I am so appreciative to be here with you. I love researching these topics, and really just makes my heart sing to know that this information helped you. So let me know, give me a little message here to let me know if you thought it was helpful or interesting. Thank you guys so much. I hope you have a wonderful rest of your night. Bye-bye.